Thank you all for being here this morning. I hope everybody has some coffee and you got something to eat. Thank you so much for being here. My name is Marcos Martinez. I'm the Executive Director at Entre Hermanos, Seattle's Latino LGBT community-based organization. And I'm also co-chair of the University of Washington's Center for AIDS Research Community Action Board and a member of the state HIV Prevention Planning Group, HPPG. Whew. So, and it's my honor and my pleasure to welcome you this morning to our Regional Strategy Symposium and our workshops on HIV. And I think we're going to have a really productive and very interesting and stimulating day and fun. So we have to really thank some folks and some organizations that have made this day possible. In particular, we want to thank Martina Morris. She's the director of the Sociobehavioral Research Corps at CFAR. Also the NIH for providing the funding to make this event possible, as well as the Health and Human Services Region 10 for their generous support. And of course, the CFAR CAB has really worked to plan this event and to make it happen. We are here today to talk about HIV prevention, and there's been a lot of conversation that's been going on for the last couple of years about ending HIV, so we want to carry that conversation forward. And so, without further ado, I'd like to bring up someone who will who almost needs no introduction and who will introduce our keynote speaker, and that is King Holmes. Dr. Holmes chairs the Department of Global Health, is the director of the University of Washington Center for AIDS and STDs, which is a World Health Organization collaborating center. He's principal investigator for the NIH-funded UW Fred Hutch Center for AIDS Research, which has over 550 members, including faculty, research scientists, and pre- and postdoctoral fellows. He is also principal investigator for the University of Washington International Training and Education Center on Health, also known as ITEC, and with HIV-related programs in 20 countries throughout the world. Dr. Holmes has participated in research on STIs for 45 years and in research, training, and technical assistance on HIV AIDS and other STIs in Africa, Latin America, Southeast Asia, and the Western Pacific for over 25 years. He's trained and or mentored more than 100 scientists involved in HIV-STI research and care in the US and other countries throughout the world. Dr. Holmes won the 2013 Canada Gardner Global Health Award for his global scientific contributions to the field of sexually transmitted disease and their effective treatment and prevention. Dr. Holmes.
Thank you very much, Marcos, and thank you for leading our Community Action Board. Why is it called a Community Action Board, by the way? Most of these CABs stands for Community Advisory Boards, and it just happened that our first meeting with this group in the program that was handed out there was a typo, and it was called Community Action Board, and we thought, well, that's not such a bad name. Let's keep it as the Community Action Board. And they actually have been very active, have co-written grant proposals to NIH successfully, and here we are today with a meeting that they have co-organized for called the Call to Action. So we're very proud of them. It's an honor to be able to introduce the meeting, the theme of the meeting, and our keynote speaker this morning. I knew that everyone would like this first slide with, as Steve Goudreau said, it's always good to start off with the gay bowel syndrome. But just historically, I'm beginning to feel a little bit like I did back in the 1970s. And it's one of the reasons for a call to action. In the 70s, we were beginning to see the huge epidemic of STDs, many new ones, the gay bowel syndrome, some new STDs, and there was the beginning of research on new approaches to treatment. And it was in this context that I went to a meeting organized by a gay physicians group that was published in the Journal of Homosexuality in 1980. And this summary of the meeting by David Ostro said that the final presentation was a keynote by me on the major advances and unanswered questions, and I really felt, as it says at this time, that we had reached the point at which the tools we had available were not working. I had thought early on that, if we developed the diagnosis, we developed the treatment regimens, that we could really control the sexually transmitted infections, and it wasn't working. They were all taking off in heterosexual and in gay populations. And so it was my conclusion, surprising to me at that time, that it was really the behavioral and sociological factors that would be critical. Well, to everybody's surprise, it was a year later that HIV began to appear, and it was in the context of this epidemic of other STDs. So where are we today? So this is what's happening in King County with respect to, for example, early syphilis. You can see on this slide that there has been a steady increase since the introduction of combination antiretroviral therapy in 1996 of a growing epidemic, and it's been predominantly in the MSM population, as you can see. And the rates of early syphilis in 2011 were higher than we have ever seen in history in King County. And this shows what's happened concurrently with rates of gonorrhea among MSM and among women and heterosexual men in King County from 1992 to 2010. And again, what you can see is this, that among, in the two lower curves, among heterosexual men and women, rates of gonorrhea have remained quite low. But among MSM, rates of gonorrhea have been accelerating and are much higher now than in the heterosexual population. And not only that, but the rates of development of antimicrobial resistance in the United States, and this is a CDC figure from the Gonorrhea Isolate Surveillance Program, and I'll be on a conference call with them in an hour, has shown that the emergence of resistance to the quinolones, to ciprofloxacin, appeared first in MSM on the West Coast, and then has slowly begun to spread further. Similarly, the introduction of azithromycin-resistant gonorrhea first appeared on the West Coast among MSM. Similarly, the appearance of azithromycin-resistant treponema pallidum first began to appear on the West Coast among MSM. So this is sort of a very brief update of what is a much bigger story, but I think it's a real cause for alarm and concern. And hence this conference. Why a call to action? I think that this is an example, only one example, of what the problems are we're facing. So we have new tools, but we have a new need for new policies and new strategies to confront the emerging risks of STDs and resistant STDs in our community and nationally as well. So this call to action is serious. And it's in the context of my own admiration and appreciation for what many of you have already accomplished. You've taught us about sexual identity, about sexual liberation, and about fighting for sexual freedom. So now, today, we have to make this symposium and workshop really effective in this context. We have to be innovative and we have to be leaders in dealing with new tools that we do have so that they'll be effective. We don't yet have multi-drug resistant HIV, and we don't have to have it. And this presentation by me is not hand-wringing or an anticipation of failure. It's just to emphasize how serious this is. What is now happening with gonorrhea and syphilis and other STDs, including some manifestations of new outbreaks of intestinal infection reminiscent of what we call the gay bowel syndrome, are already beginning again in Europe and in the United States. So we are not going to be able to go back to Big Pharma or to the NIH again and say that it is you who are failing us in providing new treatment. This is something that we can't let ourselves let ourselves down. So with that context, to help us today, in Seattle-King County, as he has helped us nationally with AIDS programs, Greg Millett is here, and Greg has a long resume. I won't review it all, but he's coordinated the National White House Office of National AIDS Policy. He's co-authored President Obama's National HIV AIDS Strategy. He helped organize the International AIDS Society Conference in Washington, D.C., which was a huge success this year. He helped to eliminate the U.S. travel ban on HIV-positive persons. He's a particular expert in HIV-related disparities among minority populations and among MSM. So, Greg, we're honored to have you here and looking forward to a lot of help from you as we continue to work in innovative ways for our own programs. So let's welcome Greg Millett.